think my highlight over the first year has been actually pulling everyone together, particularly at the Pathway Board, from all the different provider trusts, and seeing that actually every trust wants to be involved and wants to deliver the best possible care, and is actually looking to the Pathway Board for leadership in delivering this what we see as the best possible care that can be delivered within our network. And unfortunately, when we do a CT
for me, it's the ability to tap them for the resources that they have to other people. So, for example, I'm interested in survivorship, and I've found somebody at Barts who's doing survivorship courses through London Cancer. Interested in setting up a wellbeing day. Again, finding the right people to talk to is the key thing to making any kind of change and making any kind of movement.
So we've set ourselves three overarching objectives. The first is to improve survival from cancer, and in particular we want to increase the number of patients that are surviving the first year after diagnosis of cancer, because we know that will mean we'll have succeeded. The evaluation of cancer patients presenting through an emergency route is going to give us a huge amount of learning about how Londoners decide to seek medical attention and what the health system does when they make those first steps.
Through the local cancer working group, I've been working with Mike McChesney, local consultant colorectal surgeon, to increase the uptake of bowel cancer screening. There have already been some big improvements in the bowel cancer detection rate. The data are showing that bowel cancer is being detected and treated earlier across the North East sector.
We've had great success in Camden over the last year because of initiative that we took in increasing the bowel cancer screening rates. For me, I've been much better able to push that because of my involvement with London Cancer and my understandings from the colorectal board about how important early diagnosis is. So I've taken that back to my GP colleagues, and we've all been trying much harder to encourage patients to take up fecal occult blood screening.
So the earliest stages.
I think that the pathway boards are producing consistent pathways of care that all hospitals and GPs will be able to use. So you've got an even better chance of being referred appropriately, treated in the right way, whichever hospital you go to.
Our second main objective is to improve patient experience of the cancer pathway, so from diagnosis through discussing their treatment options, receiving that treatment and going through follow-up.
It is about making sure services are accessible to people, and I think it's bringing back the compassion in the treatment of patients or the care of patients through their pathway, through their journey, because I think a lot of patients feel that's missing. The treatment isn't really so much the issue, it's how they're cared for going through that.
I think London Cancer did a great job in helping in terms of whole procedure, to speed up whole procedure since the person finds out about cancer. Actually, there are changes in the last few years. There's more help for people with cancer and with cancer survivorship.
We're doing lots of patient experience, so we have quite a well-established patient experience action group. We're also working collaboratively with partners such as Macmillan on the Value-Based Standards project to improve the human aspect of care.
Macmillan are involved with London Cancer in a strategic partnership. We have developed very strong relationships, we have a shared vision, and I think the expertise that Macmillan brings alongside the vision from London Cancer will really add value so that we can radically improve cancer care for all patients in this area.
Patients are going to really start seeing the impact of this work. So, for example, with the holistic needs assessments in clinic, people are going to be asked about all the different needs that they might have, financial problems or emotional issues. They're going to be addressed and acted on, and our health professionals will be empowered and informed about how to support people.
So our third objective is to increase the proportion of patients who are accessing innovative treatments and clinical trials through research, because we know that taking part in clinical trials does improve patient outcomes. Clinical trials are very important to bring new treatments to cancer patients, to make the treatments more effective and safer. So Clinical trials require a lot of regulation and administration, and up to now it's been very difficult to open a clinical trial at all of the trusts across our system. And this has meant that patients either have to travel to access the trials, or they may not even know about them. So the greatest achievement in our first year has been that we're part of a research harmonisation project, which has allowed a single sign-off between trusts and the research sponsor to get the studies open more quickly and at more sites.